Hi friends, this session is the continuation of our previous video, that is tip and torque in various prescriptions. In the previous video, we have covered the following contents, that is introduction, definition of tip and torque, generations of pre-adjusted edgewise appliance, Andrews prescription and its shortcomings, Roth prescription and its shortcomings, and Andrews versus Roth. Please do like, share and subscribe to our channel Braces Tube. Today, we are going to discuss about MBT philosophy, which is being followed widely. McLaughlin, Bennett and Trivesi redesigned the entire standard bracket system to complement their proven treatment philosophy and to overcome the inadequacies of straight wire appliance. Now coming to torque in phase versus torque in base. Torque in phase design. LA point, base point and slot point are not parallel. Disadvantage is, as these 3 points are not parallel, there will be vertical inadequacy. So, full torque expression is difficult to achieve. And coming to torque in base design, LA point, base point, slot point are parallel. As these 3 points are parallel, advantage is full torque expression can be achieved. And this is the recent technology where brackets can be finished in a combination of torque in phase and torque in base with no difference in slot position using CAD/CAM technology. Coming to incisor torque expression, the main reasons for increasing the torque in upper incisors is class 1 cases to achieve good anterior tooth fit, and in class 2 cases as we use class 2 elastics, loss of torque on upper anteriors was observed, and in class 3 cases to compensate for mild class 3 dental bases. And coming to versatility of MBT bracket system. This is the most important topic that must be remembered. There are 7 main features. First one, options for palatally displaced lateral incisor, 3 torque options for upper canine, 3 torque options for lower canine, interchangeable lower incisor brackets, interchangeable upper premolar brackets, and use of upper second molar tubes and on first molar in non-headgear cases, and use of lower second molar tubes for the upper first and second molars of opposite side. Coming to the first one, options for palatally displaced lateral incisor. After creating sufficient space for palatally displaced laterals, the upper lateral bracket can be inverted 180 degrees to provide minus 10 degree of torque. This labial root torque aids in bringing the root forward with the crown. And coming to the second one, versatility for upper canine torque options. There are 3 torque options. Plus 7 degree for tapered arch, prominent canine roots and gingival recession, and 0 degree for ovoid arch and extraction design, and minus 7 degree for square arch forms and agenesis of upper lateral incisor. Going in detail about agenesis of lateral incisor, this means one or both upper lateral incisors are missing, and a decision should be made to close space and bring canines mesially. Here a question arises, why canine bracket, why not lateral incisor bracket? It is because the lateral incisor bracket has increased in and out when placed, causes trauma to lower lateral incisor. So, it is better to invert minus 7 degree upper canine bracket 180 degrees, thus changing the torque to plus 7 degrees. And coming to the third option, that is versatility for lower canine torque option. There are 3 options, that is plus 6 degree for tapered arch, prominent canine roots, gingival recession and overbite correction, and 0 degree for ovoid arch, extraction design and rapid palatal expansion cases, and minus 6 degree for square arch forms. And coming to the fourth one, that is interchangeable lower incisor brackets. As the tip is 0 degrees, the lower incisor brackets can be interchangeable between right and left sides. And going to the fifth one, interchangeable upper premolar brackets. As the tip is 0 even for the upper premolar brackets, these can be interchangeable between right and left side and also first and second premolars. And going to the sixth one, use of lower second molar tubes for upper first and second molars of opposite side when finishing in class 2 molar. When finishing in class 2 molar relationship, we can place lower second molar attachments on upper first and second molars of contralateral side, as they have 0-degree rotation and encouraging upper molar to rotate mesiopalatally. And here also a question arises, why only the lower second molar, why not the lower first molar? Because lower second molar torque value is nearer to that of upper molars, that is lower second molar has a torque value of about -10 degrees and upper molars have -14 degrees. And going to the last one, that is use of upper second molar tubes on first molar in non-headgear cases. Upper first and second molars have similar tip and torque, that is 0-degree tip and -14-degree torque. So, upper second molar tube can be used on first molar on the same side in non-headgear cases. Now dealing with Andrews versus MBT, first I will be explaining about upper arch followed by lower arch. Now coming to tip in the upper arch, incisor tip was decreased to reduce strain on molar anchorage and canine tip was also reduced to upright roots and prevent canine root proximity, and posterior tips was made to 0, that is elimination of mesial tip on all buccal segment teeth strengthened anchorage control significantly. And now coming to torque of upper arch, the incisors torque was increased to counteract torque loss during overjet reduction and space closure, and canine and premolars torque was maintained same, and torque of molars was increased to prevent palatal cusp hanging. Now dealing with tip of lower arch, incisor tip was decreased to reduce strain on molar anchorage, and canine tip was decreased to upright the roots and prevent canine root proximity, and premolar tip was maintained same, and molar tip was decreased for anchorage conservation. And now coming to the torque of lower arch, incisors torque was increased to limit lower incisor proclination on leveling, and canine torque was reduced to reduce canine root prominence, and posterior torque was decreased to prevent lingual rolling. And these are the references that are mandatory to quote in your exams. Coming to Roth versus MBT, here also first we will be discussing about upper arch followed by lower arch. Now dealing with tip of the upper arch, incisors tip was reduced to reduce strain on molar anchorage, and canine tip was reduced to upright roots and prevent canine root proximity, and posterior tip was maintained same. And coming to the torque, the upper anterior torque was increased to counteract torque loss during overjet reduction and space closure, and posterior torque was maintained same. Now dealing with tip of lower arch, incisor tip was decreased to reduce strain on molar anchorage, and canine tip was decreased to upright roots and prevent canine root proximity, and premolar tip was increased to achieve class 1 intercuspation, and molar tip was decreased for anchorage conservation. And now coming to torque of lower arch, incisor torque was increased to limit lower incisor proclination on leveling, but canine torque was decreased to reduce canine root prominence, and posterior torque was also decreased to prevent lingual rolling. Reasons why the torque is decreased in the lower arch. As I said before, this is not only to prevent lingual rolling of molars, but also there are of three other reasons. First one is gingival recession. When present in lower cuspids and bicuspids, if we reduce the labial root torque, the teeth benefit from roots being moved closer to that of center of alveolar process. And second one is frequently orthodontic cases show narrowing in the maxillary arch with lower posterior segments that are inclined lingually. That is, there will be increased labial root torque. So, in those cases, buccal uprighting is favorable treatment step in the lower posterior segment. And third one is lower second molars often tend to torque lingually, particularly when the lower second molars have buccal tubes with minus 35 degree or more of torque. For these reasons, the MBT reduces the lingual crown torque on lower cuspids, bicuspids and molars. And these are the references that are mandatory to quote in your exams to get good result. And the reason why we choose this topic is as it is one of the important question in the paper 3. And it is asked as define tip and torque with diagrams, write about their prescriptions used in fixed appliances. And before ending up, I just want to summarize the topic by adding contents to it. And this plays a major role in your exams. Before starting any answer, you need to write the contents so the examiner will have the clear outline of the answer, which helps to gain more marks. Thank you. Please like, share and subscribe to our channel Braces Tube.